Very good morning. I hope to see you all in today's Apollo 24/7's Health Hour, where we are going to talk about heart health. What are the early signs of cardiovascular diseases? If heart disease starts, what are the ways to prevent them? Can this be undone? Let's understand more about our heart and its health. Joining us in this live session today is Dr. Rajeshwari Nayak, a senior consultant cardiologist from Apollo Hospitals. So join us in the live session and ask all your questions. See you there.
माल पूरा है?
हाँ सर,
मम्मी,
पूरा है।
पापा टाइम पे है?
अपोलो से है सर।
थैंक्स। हाँ, पापा के बीपी का इशू है, so every medicine has to be on time.
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं अपनी पूरी प्रिस्क्रिप्शन की डिलीवरी सिर्फ 2 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show which brings you closer to an Apollo expert every Sunday. This show is answering the questions that you have been wanting to answer an expert and get an advice. So go on, ask your questions in the chat box. Today we are going to talk about heart diseases, knowing the risk factors and prevention. Joining us shortly is Dr. Rajeshwari Nayak, Senior Consultant Cardiologist from Apollo Hospitals Greams Road, Chennai. So get ready with your questions. I see that a lot of people have already joined us, and I see that a lot of people have asked their questions and queries. Go ahead, type your own question and we shall take these questions shortly. And understanding that accessing to good healthcare is very important, and especially in these kind of pandemic times that we've been witnessing since last 2 years, online and having a good trusted network is very important. I urge you to download Apollo 247, an app which brings you entire Apollo Hospital into your palm. And just by having this one app, you can access so much. So go ahead, download the app. Also in the show, we're going to answer your questions. There's an expert who's going to talk about heart health. But towards the end of the show, we are also giving you an opportunity to participate in a health quiz, answer 3 questions that I'm going to ask you, and win prizes from Apollo 247. So, in case you have Apollo 247 app in hand, it'll be, 1 or 2 questions might be from the app. So, it'll be helpful if you have the app. Go ahead, download the app, and have a great plethora of benefits there. Let's start the show today by talking about a wonderful initiative which is called Saving the Child's Health Initiative. This is, in short, SACHI. SACHI is free pediatric consults for every child in need in association with Apollo 24/7 and Apollo Foundation. SACHI is trying to give quality healthcare, and it's making quality healthcare accessible to underprivileged children at no cost. So there are more than 10 plus pediatric specialties and then renowned Apollo pediatricians who are coming forward to give their services, which benefits children across India. To know more about this initiative, scan the QR code which is on the screen, or there's a link also in the chat box. Let's continue today's show. We are going to talk about heart diseases, know the risk factors and prevention. Joining us is Dr. Rajeshwari Nayak, Senior Consultant Cardiologist, Apollo Hospitals Greams Road, Chennai. She has more than 20 years of experience treating patients with severe cases of heart diseases. Her special areas of interest are primary angioplasty, robotic angioplasty, and heart failure management. She is the first female cardiologist from India to perform robotic assisted PCI, and she is an academic coordinator for the postgraduate studies in the cardiology department and author of several papers in international national journals. Namaste, Dr. Sam. Namaste. Welcome to the show.
Namaste, Jansi. Thank you to be here.
Wonderful. One great advantage of having Dr. Rajeshwari Nayak here is that she can speak 8 Indian languages, or English के साथ 7 languages बात कर सकते हैं, ma'am. So what are the languages that you speak, ma'am?
Yeah, Jansi, I can speak Konkani, which is my mother tongue, and I studied in Kerala, so Malayalam. After that, my medical education was in Karnataka, so Kannada, Hindi, and English, of course, now in Tamil Nadu. And I had to learn Telugu and Bengali as part of being in Apollo Hospital to serve the patients better.
Oh, it's a wonderful thing to know so many languages, and it's a blessing in its own way, ma'am. I think you can connect with your patients more, and patients will feel really very comfortable in their own language. Thank you for doing that. And so it's a great thing to know that you know languages, and people, please go ahead and ask if you're feeling comfortable in your own language. Ma'am will definitely go ahead and answer. So let's understand heart diseases, ma'am. There's so much of news all around that I hear younger people falling prey to heart disease these days. Earlier, we used to think that heart disease is only for seniors and elderly people. But now there's so many cases that I'm hearing. What is this trend? Is this something new that we're facing, or this has been earlier also?
See, this is something new, Jansi, and we are seeing more and more young people, as young as 20s and 30s, coming with heart attack and heart failure. As a country, India, we see heart disease nearly 20 to 30 decades before what happens in Western countries. In Western countries, heart attack is common at the age of 60s and 70s. But in our country, it is 40s and 50s. But of late, we are seeing 20s and 30s people coming with a heart attack. The main risk factor being stress and smoking. So I
Okay.
think people have to put interest into taking care of their stress, and also, a big no to smoking.
Oh. Right, ma'am. So, are these the only 2 reasons, or are there any other genetical factors, or Indians being prone to early heart diseases? Is there something of that sort also involved?
Yes, actually, India is considered as heart disease capital. We have huge
Okay.
population, and the prevalence of risk factors like high blood pressure, diabetes, smoking, cholesterol, stress is very high in our country. And the genetics, of course, plays a major role, as you said. Anyone who has a strong family history of heart problem, that is, when we say strong family history, father, mother, or any first degree relative having a heart attack before the age of 60, it becomes a major risk factor for children. All those people should care for their health better and get medical consult done much earlier and periodically.
Okay. So, what are the types of heart diseases? When you talk about a heart disease, what is a heart disease and how do we understand a warning sign that a heart sends?
Heart disease can be ischemic heart disease, what we call heart attack, and heart muscle damage occurring following heart attack, what we call heart failure. Diseases secondary to high blood pressure, uncontrolled high blood pressure, what we call hypertensive heart disease, poor pumping of the heart, poor filling function of the heart, what we call diastolic heart failure. So this goes on. The list is very big actually.
All right. So there must be some kind of warning signal. There must be something which is like, I have to take care of my heart.
Yes, anyone who experiences any kind of discomfort in the chest in the form of pain, burning sensation, so some heaviness, or a breathing difficulty, palpitation. Palpitation is fast beating of the heart, or giddiness, or dizziness, or sudden collapse. All this could be warning signals or signs of a heart problem. And whenever a person experiences all this, he or should get a medical consult done immediately without any delay, because earlier the person goes to the hospital and get medical consult done, better will be the benefit and less will be the complications.
Wonderful, ma'am. As you were mentioning earlier in one of the answers, that smoking and stress and other lifestyle issues are also causing heart issues. What are the actual factors that might cause, or any other causes that you want to add to the previous list?
See, stress is a major risk factor, especially in young. We are seeing people having a major emotional setback at home or in the office, coming with heart attack and stroke. And yeah, the major stress in the form of breakup or a loss of loved one, all these are major risk
Right.
factor for heart attack and stroke. So any stress in any form has to be addressed. People can take up hobbies, address the stress with their friends and families. If nothing works out, they should consult a psychologist for their further support. Never live with, my advice to you all is never live with stress. Stress is a very major risk factor for heart attack and heart disease, and that also can be completely taken care. So take care
One.
of your stress.
Yes, and if you want to live happily and if you want to keep your heart happy, keep the stress away. In case if you require, there's nothing wrong in taking therapy, is an expert's advice here. Right, ma'am. So we've understood that there should be good lifestyle factors and you should be stress free. And what are the best foods to take care of heart?
Yeah, we say include lots of fruits and vegetables in your diet. Avoid ghee, butter, cheese, that is saturated fat. Avoid red meat. When we say red meat, it is, the
The
goat meat or the beef, all those. Lean meat in any amount is allowed. So avoid sugar, high sugary substances. Reduce your carbohydrate intake, and say big no to smoking, and alcohol always in moderation. This will be my advice.
Wonderful, ma'am. So, we prevent heart disease, and then also can a heart disease be reversed or slowed down in progression?
Yes. It's a good question, Jansi. To a large extent, heart disease can be prevented. What we say, nearly 50% of the heart attack, what we see coming to our emergency, can be prevented provided appropriate measures are taken. And this appropriate measure should start at very young age, as young as less than 10 years. The parents have a big role to play here to teach children to eat healthy, to motivate them to get some physical activity or exercise regularly, which should continue throughout their life period. And even in adolescence, maybe try to avoid smoking, avoid stress. There's a time people go through stressful period. When it comes to alcohol, reduce the alcohol, continue to exercise. If you have a strong family history, get a regular checkup done at an early age, consult your doctor early age, maybe at 20s. If you do not have a major family history, maybe you can start your regular checkup at the age of 30. And if you have high blood pressure, diabetes, control it well. Check your blood pressure and sugar at home, control it well. If it is not under control, go back to your doctor to up titrate the dosage of medication so sugar and BP can be controlled well. And if you already have heart problem, take all the medicines given by the doctor correctly. Many a time patients tend to reduce the number of patients given by the doctors, which is not good. There are medications like statin, cholesterol medicine, to a certain extent or bigger extent, it reverses the heart problem. So healthy lifestyle along with good dose of medications, controlling risk factors, we can prevent heart disease and to a certain extent reverse heart disease too.
Wonderful. Ma'am, as you're talking about medication and the prescription, I was just looking at one of the audience's question. Mr. Vivek Kundu has typed, do cholesterol medicines to be continued on long term, or should doctor be consulted at any interval? My doctor is advised to take these medicines for 3 months.
See, cholesterol medicine usually, people who have high blood pressure, diabetes, high cholesterol, strong family history, or a heart problem in the past, all those people will need cholesterol medicine lifetime, because cholesterol medicine will prevent heart attack. It will, even if you
Oh.
have a block within the blood vessel or to the blood vessel going to the heart or brain, this cholesterol will medicine will stabilize the plaque becoming unstable, the plaque or block giving heart attack and stroke is prevented to a large extent by cholesterol medicine. So people having high blood pressure, diabetes, and a strong family history, CAD, heart attack, continue lifetime statin. But always check with your doctor, because there are certain other parameters which they will look into to reduce the dose or increase the dose.
As you anyway are answering this question regarding statins, there's yet another question from Mr. Gangeshwar Prasad Dwivedi. Kindly let me know how essential is it to use statins? Can it be discontinued in case of depression to the patient? Risk versus benefits.
So statin definitely causes, in a small percentage of patients, it can cause depression. So
Acha?
depression is a major issue. Then you should consult your psychologist or psychiatrist. If the psychiatrist says it is contributory, I mean statin is contributory to his or her depression, maybe we'll have to reduce the dosage of statin. But the benefit from statin is so much so that if the depression is mild or depression can be taken care with other ways and means, we should continue statin.
Right. And as you were talking about young population and heart diseases which are on rise in India, I have seen a lot of friends, especially in our film industry, from our film fraternity in India, and also a certain fitness enthusiast and sports person collapsing right in their activity, in the midst of activity. What is this? We keep saying that exercise is very important and being fit is very important for heart health. What has caused wrong? Is exercise, especially the strenuous exercise, playing a role here?
I'm very happy you asked this question, Jansi. As you said, see, exercise is good. Everyone should exercise. Exercise is good for health, but there should be a moderation. Anything in excess is not good. We are seeing people exercising too vigorously and going beyond 90, 100% of their heart rate. This can cause very high rate heart blood vessel will not withstand the stress of very high heart rate, because in our blood vessel there is a deposit of cholesterol which starts at very young age, maybe at the age of 10 or so. Over a period of time, it forms a thin layer of cholesterol within the blood vessels. when this person, he or she, exercises very high heart rate, when the heart rate goes beyond 90 or 100% of the heart rate, this thin layer of cholesterol can break and cause heart attack. Person can collapse in the sports ground or wherever the person is exercising. So my advice to you all is exercise, but exercise in moderation. Check your heart rate. Do not allow your heart rate to go beyond 90% of your expected target heart rate. How will you calculate the target heart rate?
Ah,
20
this is what I
minus.
wanted to ask.
Okay. 220 minus age of the person. For example, if a person is 50 years, 170, 220 minus 50, 170 is his or her 100% heart rate. Calculate 80% of this or maximum 90%. That means it will be about 130. Don't go beyond 130. For
So
everyone, you
never,
check heart rate.
so it is not a standard measure for everybody. It
No,
is
where is
according to your age
the
and then the percentage. And how much of exercise have you been doing, and what kind of cholesterol or what kind of history that you have. All of these matter when you start exercising rigorously.
Yes. And
All
if
right,
you
that's it.
have a heart problem, sorry, Jansi, if
No, please.
you a person has a heart problem, better to consult your doctor with regard to what kind of exercise he or she can do. Doctor will do the echo treadmill test and tell you uh, what are the activities as a physical activity that person can take.
Right. So, as you're talking about tests, what are the tests that one can take, and when does one need to consult a cardiologist?
Yeah, any symptoms of heart disease in the form of breathing difficulty, chest pain, chest discomfort, burning sensation, some jaw pain, palpitation, dizziness, and fall. All these are symptoms of heart problem, different problems. When in doubt, please go to the doctor. Until unless proved otherwise by doing an ECG and echo, and the doctor sometimes enzyme tests, doctor says, yes, you are cleared, this is not heart problem, maybe a gastritis or some gastric related symptoms. You shouldn't take it lightly. We are seeing people coming after 2 3 days of chest pain. They think it is gastritis, they take medications for gastritis, come very late to the hospital. By then the heart muscle damage would have been significant, and when we treat the patient, the benefit from the treatment, of course we can treat, the treatment has extensively progressed in our field, but the benefit which the patient get is less, and complications arising out of procedures is bigger. So don't delay, get medical help early during your symptoms.
Right. So I have a range of people around me where I have lost one of my staff, my costumer, to heart attack, who's under 40, and sudden collapse, and he passed away. And I have a friend who complains continuously of palpitation. I have a friend who's under 40 who has high cholesterol. And all these cases, one case we couldn't even find out that he had a heart issue. The other cases, we've taken them to cardiologists, but they said nothing to worry. So how often does one need to consult a cardiologist?
See, this person, whoever collapsed suddenly, I don't know whether he would have had some warning symptoms. Usually, there will be some warning symptoms 1 or 2 weeks or few months before, while exerting, he or she would have felt some, discomfort in the chest, or would have had high blood pressure, diabetes, strong family history. All this should make the person to get a medical consult.
Awareness was important. So I understanding all these were important, which one wouldn't he wouldn't have identified all these earlier, and we couldn't help him in that case.
Yeah, but Jansi, a person will not collapse suddenly. They usually will have some symptoms, but unfortunately, people tend to ignore these symptoms. See, for no reason, nobody will collapse. The symptoms would have started. If he or she is exercising while walking, they will feel some kind of discomfort in the chest, some kind of breathing difficulty. That is a early sign of heart problem.
Right.
Very rarely, maybe that stress suddenly during stress, a major fight or a setback, emotional setback in the office and or at home. person can collapse without any warning signals. So that's why we say stress in any form to be avoided. We have seen people having a major, setback in the office, a fight with, employer, and having a heart attack and coming. So all these are possibilities. So the person has to
Take
take care.
care of these, yes, take care of these warning signals, take them seriously, and understand your heart health. Ma'am, this my one of my colleague and one of my good friends, who's a female, she ignored till the time that I pulled her to a cardiologist. Women tend to do this. Are women more prone to heart diseases? And why is it that we hear more of heart diseases in women?
Yes, and say again, a very good question. Earlier, we used to think heart disease is a disease of men, but not anymore.
Yeah.
We are seeing women as young as 30s, 40s coming with heart attack and other heart diseases. And as you correctly said, women tend to ignore their symptoms because
Yes.
of family priorities. They will say children's exam or something is happening in the family. Let me take care of the spouse's health, and everything is in a back seat for the lady at home. My request to all women there is take care of your health. You are very important for the family and society. So any warning signal, think that you are also as important as the man of the family. So go to your doctor, get a regular checkup done, exercise well, control your weight, all that. Take care of your health, don't delay in getting. And as another point I would like to say is women tend to have more severe disease when they come to cardiologists, because they tend to come very late, and when we do angiogram they will have more severe diseases. If only they come early, maybe they would have come 2 3 years earlier. They will stretch it so much. And when they undergo procedures like angioplasty or bypass surgery, the complications, the risk will be slightly more than the male counterparts, again because of the delayed presentation and more severe diseases.
All right. So here's a question. Sudhanshu Kumar is asking, Good morning, doctor. I'm 35-year-old male. I have left side chest pain since more than 5 years. Multiple ECGs, TMT, echo, X-ray have been done, but nothing is found. Can you please suggest a way forward? And I also have a friend who's under 35, under 40 actually, and who has cholesterol issues, who gets regular tests done, but there's nothing in the heart showing up. Should these people be careful and continue their tests and monitor up?
Yes. I'll answer Mr. Sudhanshu's question first, Jansi. Good morning, Sudhanshu. I heard that your TMT and echo is normal. That means cardiologist has seen you. It depends on what type of pain you have. The pain could be heart pain, or foot pipe pain, or muscular pain, or bone pain. Most probably it could be muscular pain or bone pain. But still, if you have doubt, go back to your cardiologist, ask the doctor whether he can do a CT angiogram for you, because that will confirm. Many a time treadmill can be falsely negative, but I'm sure your doctor would have done a good job of getting a good history done and going through all the investigations. But if you have doubt, most probably it could be muscular pain. But nowadays we have a cardiac CT angiogram, which will give 100% answer to your question, and that is normal. You can be safe, peaceful. And Jansi,
Right.
for the other question with regard to cholesterol, you asked, isn't it?
Yes, ma'am. Cholesterol, high cholesterol, and heart parameters are all normal.
Yeah,
Should they
high
be
cholesterol.
continuously going?
If she or he has any other risk factor in the form of diabetes, hypertension, strong family history, or smoker, the cholesterol medicine has to be continued. If none of these risk factors are there, and the cholesterol is just borderline or less than borderline, then she has to follow a strict lifestyle modification, that is healthy diet, with the regular exercise, and avoid stress, avoid smoking, reduce alcohol intake, and check cholesterol after 6 months of all these. And if it is within normal range, continue to do the lifestyle modifications.
Right, ma'am. As you were talking about TMT test, Srinu Reddy is asking this question. Does TMT positive mean a risk?
TMT can be falsely positive, falsely negative. So we have to take the person as a whole. So if you have chest pain, positive TMT at S, it signifies there could be block in the blood vessels. If you do not have any chest pain, if there are minimal changes, many a times it could be falsely negative. So that is why we have to examine the patient, talk to the person, and see the tracing. There are certain changes in the ECG which suggest false negative that only a cardiologist will be able to tell you.
Okay. Next question is from Mr. AK. नाम नहीं दिया है इन्होंने AK करके है. Please let me know how serious is diastolic dysfunction of left ventricle on echo and hypertrophy of left ventricle is. I am diabetic and I suffer from Crohn's and asthma.
Okay. See, diastolic heart failure is very important, as important as systolic heart failure. Systolic heart failure, when we say poor heart pumping, in diastolic heart failure, pumping is good, but the filling function of the heart is affected. So, with regard to risk of a person with a diastolic heart failure, it is as high as or worse than the person with a systolic heart failure. But we have very good treatment for diastolic heart failure patients, controlling the sugar well, high blood pressure well, reducing the salt, taking the medications regularly, and getting a regular checkup done. People can have a reasonably good quality of life and also a better longevity.
Right, ma'am. So as you were talking about salt, I found a question on sodium. Mahendra Kumar Jain is asking, please let me know how low sodium levels will affect the heart and how to increase sodium levels as the level is 125 and my father is 75-year-old.
Yeah, see, so low sodium level in a elderly person with heart problem could be because of the diuretics which we use, or because of fluid congestion, because of poor heart pumping. So what we call either dilutional hyponatremia or depletional hyponatremia. So if it is hard for me to say because I haven't seen the patient and other details, but if you can go to the doctor, he or she will help you, because if it is depletional, we will have to increase the salt intake. If it is dilutional, we will have to reduce the salt intake and give diuretics and remove. So which one will help him, only the cardiologist will be able to advise.
Done, ma'am. Thank you so much for answering that. Kalyan Sundarampi is asking this question. Is EECP, that's an abbreviation there, is EECP a panacea for CAD and accepted in India? And it'll be
ECPs.
helpful for a lot of other patients and other viewers. If you can brief what EECP and CAD are.
CAD is coronary artery disease. EECP is enhanced external counterpulsation. So it is recommended only for people who have coronary artery disease, extensive blocks, where the person cannot undergo angioplasty or bypass surgery, what we call non-revascularizable blocks, and the person is on optimal medical management. Despite that, this person has chest pain or breathing difficulty, yes, ECP is recommended.
Okay, ma'am. Next question is Mr. TV Soundararajan. Okay, I'm sorry, Soundararajan साहब आपने कुछ और details नहीं दिया, बस tablets का dosage दिया है. So please go ahead and type other details as well. Rajan Puri ji का question है, what is a good way to lose weight without affecting the heart?
Okay. See, diet and exercise plays a major role. So reduce your carbohydrate intake, reduce your sugar, sweet, rice intake, reduce your red meat intake, include lots of complex carbohydrate, high fiber diet, lots of fruits, vegetables, and lean meat, and exercise regularly. And you calculate your ideal body weight. Your height in centimeters minus 100 will give you your ideal body weight. If you are 160 centimeters in height, minus 100, 60 is your weight. So try to lose 1 kg per month. I'm sure you will reach there in whatever weight, 1 year, 1 or 2 years time. But do it gradually.
Don't get stiff with it. Most importantly, don't get obsessed or stressed with losing weight. Yeah. Next question I would like to ask you is, ma'am, Tyagarajan Palniyappan. He had an AVR surgery 1.5 years ago. Now he doesn't have a problem. What are the do's and don'ts in future? What is an AVR surgery, ma'am?
AVR surgery is aortic valve replacement surgery. He would have undergone an open heart surgery either with a mechanical valve or a tissue valve. Usually durability of both the valves nowadays is very long, something like 15 to 20 years. But only thing, the person has to take regular medicines given by the doctor. It will be hard for me to discuss with regard to that because I don't know whether it's a tissue valve or mechanical valve. And yearly get a echo done, which will tell the valve functioning, whether valve is getting reblocked, re-choked. All that we will know from the echo. And if you have high blood pressure and diabetes, control it very well, because uncontrolled blood pressure and diabetes will cause more choking or re-choking of the valve, may need early redo surgery. But we can avoid it or prevent it totally by taking care of the associated risk factors and regular exercise, and don't smoke.
Done, ma'am. Next is Suburangan Vijay Raghavan. I've undergone a VSD in 1992. Occasionally, I hear breathing sound in my ears. So, though he gets tested every year, he's still worried about it.
VST done long back, and if you're doing well, I'm sure the cardiologist would have done an echo. I don't think this sound in your ear is related to heart. Could be, some ear block or, what we call tinnitus. Maybe better to consult a ENT doctor. They will check up and help you.
Done, ma'am. Gayatri Swami's next question is, my EF rate is 38%. I was under treatment at a heart center from 2013 onwards, but my EF percentage is 38 only. So how to increase the treatment for my EF under advice?
Low ejection fraction could be because of two reasons. One is heart muscle pumping weak, what we call cardiomyopathy. Other one because of the heart blood vessel blocks, what we call coronary artery disease causing poor heart pumping. If coronary artery disease is causing poor heart pumping, the doctor will do an angiogram test, see whether there are blocks, remove the blocks, the heart pumping improves. If the coronary arteries are normal, that means it is muscle problem, heart muscle problem, cardiomyopathy, which occurs either due to no reason at all, which what we call idiopathic, or because of high blood pressure or diabetes. In such cases, the diabetes and high blood pressure has to be controlled well. And I would like to say that our therapeutic armamentarium in the field of heart failure and poor ejection fraction has grown so much so that we have many newer drugs which will help our patients. So I think you can discuss with your local cardiologist or whoever is taking care with regard to that.
And also Apollo 247 gives you an opportunity of consulting Dr. Rajeshwari Nayak online. Also, other cardiologists are available. You can download the app and consult them online. Right. Next question, ma'am. नाम नहीं दिया है, मैनेजिंग डायरेक्टर के नाम से आया है. I have undergone angioplasty in 2013. Ever since I've been taking Rosuva's 20 mg and 10 mg in the night, apart from Plavix. Is it needed to take it for such a long time? Can this cause CKD, chronic kidney disease?
No, it will not cause CKD. It will help you to prevent reblock coming. So statins long term and a small dose of the blood thinner medicine is must for secondary prevention. When I say secondary prevention, another episode coming of a heart attack or stroke. So continue the drugs and don't fear about CKD. If it is going to cause CKD, definitely your doctor will not prescribe those medicines.
So the other advice that I would want to give is, don't go by the Google. That is not a great advice. Trust your doctor on this.
Yes.
Because a lot of side effects will be mentioned there, and that causes unnecessary worry and stress. Right. Ma'am, next question is from Mr. Krishna Kitur. 73-year-old male, 70 kilos, HTN and DM2 diabetes under control. Taking a medication tablet, Paromet XL, Losar, accelerated BP every 6 months, ECG normal, echo shows diastolic dysfunction, GDE1, LVEF 60%. Kindly advise.
So accelerated hypertension every 6 months, he's saying, isn't it?
Yes, ma'am.
That
Yes,
means
ma'am.
your blood pressure is not under control, sir. So maybe you will have to up titrate the dose of medicines. If you are not exercising, get at least 30 minutes of walk. If you haven't reduced your salt intake, reduce. You can only take 3 to 4 grams of salt per day. Being a hypertensive, especially if it is not under control. When you are saying accelerated hypertension every 6 months, that means your BP is not under control. So only medicines will do half job, rest of it is in your hands. No smoking, get 30 minutes of walk, reduce your salt to 3 grams. Don't take anything which contains excess salt, like what we call appalam, papadam, all these salted canned items, etc. All this will cause sudden surge in blood pressure. And get a BP apparatus at home. Check it every Sunday. Make sure that your blood pressure is 130 to 140. Not allow it to go below above 140. If it goes above 140, you can increase the dose of medicine yourself. Better not to increase yourself. Go to your physician or
Yes. Under
cardiologist.
consultation. Yeah. Next question I'm going to take is from Mr. Jayshankar Tiwari. I have a proximal atrial fibrillation, and what is the best way of treatment?
Yeah, atrial fibrillation is an electrical disturbance wherein the upper chamber of the heart beats very fast, as fast as 300 times. It could be with reason or without reason. I'm sure the cardiologist would have done evaluation. If there is a reason, the reason has to be treated. Atrial fibrillation becomes better. If there is no reason, that means there is no structural abnormality of the heart, that means it is non-valvular atrial fibrillation. There are different kinds of treatments available. We can give certain medical cardioversion drugs or electrical cardioversion, wherein we can make this electrical disturbance into normalcy. That normal sinus rhythm not working, you can get an electrophysiologist opinion. They will do electrophysiology study and RF ablation, make it all right. If none of this works or you are not interested in all this, you have to take drugs lifelong to reduce the heartbeat and also blood thinner medicine, because you are at high risk of stroke. So you should consult I'm sure your doctor would have given you these drugs. If not, the blood thinner medicine is very important for you to prevent stroke.
All right. Next question is Bindu Vivek's question. Do blockages clear on their own?
No, usually no. If it is only a blood clot sitting, young people we see following a major stress or something, a blood clot, a thin layer of cholesterol ruptures and a small blood clot sits there. Sometimes body's mechanism per se will lyse this clot. So by itself it can, but that happens out of 100, only 4 to 5 people. Rest of the 95 will need treatment. So we don't know who are those 4 to 5. So everyone should go to the doctor, get the treatment, do an angiogram, make sure that arteries are normal, because any block remaining there, they are at a very high risk for second heart attack.
Okay. So next question is my heartbeat is 110, 118 for last 1 month. Please advise what should I do? I had an angioplasty in 2020. This is Vinay Gupta's question.
Okay. After an angioplasty, if the heart rate is more than 100 all the time, it is not good for the heart. Usually, cardiologist gives the person heart rate lowering medications. So, if you are not on heart rate lowering medications, maybe better to go back to your doctor and discuss about it. If you are already on heart rate lowering medicine and it is high, maybe doctor has to increase the dose of medicine or look into the causes why it is high. There are different reasons like thyroid dysfunction, sometimes infection, sometimes anxiety or anemia. All these are associated factors which will increase the heart rate in a person with coronary artery disease. Unless we address all those problems, we may not be able to reduce the heart rate. So better to
Okay.
consult your doctor again.
Done, ma'am. Next question is from Mr. Shobit Dwivedi. He's asking us to explain about ectopic heartbeat.
Ectopic heartbeat is very common. See, one ectopic, that is extra heartbeat. A
Oh,
person's, all of us should have a heartbeat which is regular. It has to regularly going, 60 to 80 times in a minute. Sometimes the one extra beat can come in between two normal beats, what we call ectopic beat. It can come from anywhere in the heart. Many a time it is benign, but if the person is feeling that extra beat frequently, it is giving him discomfort in the chest or palpitation, giddiness, all this, go to your doctor. Doctor will do a echo and a Holter monitoring. Holter monitoring is 24 hours recording of the ECG. That will tell us how much extra beat you have, whether you really need medications or we can just leave it, which is benign.
done. There's a lot of questions about cholesterol. A lot of people have given Shravanti, Rahul, and a lot of people have given their cholesterol data and are asking how much medicine to take and is it normal to have such amounts of cholesterol and triglycerides. Just to explain what is a high amount of cholesterol or triglycerides and what is more dangerous to heart, to touch upon and to conclude the cholesterol questions. I cannot take individual questions because everybody is mentioning the cholesterol details and are asking for advice.
See, high cholesterol is a major risk factor for heart disease and stroke. So, with regard to high cholesterol, whether it needs treatment or no depends on all the parameters: bad cholesterol, good cholesterol, triglyceride, how much it is, and whether the person has other risk factor in the form of diabetes, high blood pressure, smoking, etc. So, ideally, your total cholesterol should be less than 180. The triglyceride should be less than 180. Your LDL cholesterol should be less than 100. But if you do not have any risk factors, I mean, you do not have any heart problem, if you do not have any high blood pressure, diabetes, even 130 to 140 of LDL, we accept and tell the people to take care of their diet and exercise and reduce alcohol intake and reduce smoking or stop smoking. When you do all this, your cholesterol will come back to normal. So if it is not coming back to normalcy, that normal range, that is when doctor may consider giving you statin. So simple measures in everyday life: 30 minutes of exercise, avoid red meat, ghee, butter, cheese, reduce. I'm not saying to stop. And avoid alcohol. Alcohol will push up the cholesterol very much. Alcohol is full of cholesterol and calories. Smoking will
Right.
increase cholesterol. So, yeah.
Yes. So take care of your cholesterol, take care of your heart, everyone. And here's the next question, ma'am. Ashok Srivastava is asking, 60 years age, angiography conducted with no blockages, blood flow slow was diagnosed. Should I take any medications as left side chest pain sometimes? What precautions should be taken?
Yeah, slow flow is good that you did not have any blocks. Slow flow within the blood vessel means there is endothelial dysfunction. That means inner layer of the heart blood vessel has some dysfunction or small vessel disease. So it's not a major disease like a person with blocks within the blood vessel, but you will need medicines like blood thinner medicine. And if your heart rate is high, doctor will give you medicines to reduce the heart rate. If blood pressure, sugar is there, that those medicines, yes, you will have to be on a blood thinner medicine, definitely.
Okay. Divya is a young girl, 25-year-old. ECG, blood test, everything is normal, but palpitations are still there. And my resting heart rate sometimes is less than 100 and sometimes is more than 100. I'm currently taking Inderal 10 mg as prescribed by doctor. What's your advice on this?
Yeah. In young people with palpitation, usually we tend to give Inderal small dose, but we need to find out why young person has palpitation. So usually we need to check thyroid function test, anemia, a 24 hours Holter monitoring, an echo, and if everything is normal, if she continues to have palpitation and she's uncomfortable because of that, a small dose of Inderal will help.
Wonderful, ma'am. Sanu Saha is asking next question. I'm suffering from GAD. I'm going through treatment, Nexito, beta cap, and I have some palpitation issue, but heart rate remains normal. Do I need to worry?
No, high palpitation, if a high heart rate palpitation is common in people who are anxious and or depressed, all that. So many a time anxiety is taken care, it comes down. But despite that, if a person has high heart rate and palpitation, then doctor will prescribe usually the same Inderal or Ciplar group of drugs, small dose. But associated problems, as I said, anemia, low hemoglobin, thyroid, all that has to be ruled out. If it is not done, it should be done.
Done. Next is Arthanari BS. 2017, I've undergone angioplasty, two stents inserted. Last month, echo was taken. Everything is normal, but one observation, mild pulmonary arterial hypertension. What does it mean? Do I need to worry?
Yeah, pulmonary arterial hypertension in the presence of normal heart pumping could be because of diastolic dysfunction, what we call diastolic heart failure, or because of uncontrolled blood pressure, or if you have any lung related problems in the form of asthma, COPD, other lung problems that also can push up the lung pressure. So I'm sure the doctor would have given you medications which will, balance the both. But it's a concern. But it's not a major concern. It can be taken care. Yes, it has to be normal. Lung pressure has to be normal. If it is mildly elevated, it's better to look into why it is high and take care now itself.
Done, ma'am. Next question is from Mr. Rakesh Ambasana. Can chemotherapy be taken for cancer treat? Chemotherapy, which is taken for cancer treatment, does that have effect on heart?
Yes, it will affect the heart. So it depends on what kind of chemotherapy you have taken. Certain groups of chemotherapeutic agents causes heart muscle dysfunction. That is why always before taking the chemotherapy we get an echo done 1 month after that, then periodically for a period of 1 year. But there are patients coming with after 5 to 10 years of taking chemotherapy for different cancers with poor heart pumping. So recently, I've seen two patients who have come after 10 years of, treatment for cancer, coming with heart problems. So
Oh.
periodic checkup is needed, and again, it can be taken care. Treatment is there, but echo should be done. Should consult a cardiologist.
Okay, ma'am. Thank you so much for giving this answer. All right, Anurag Jain is asking this question. Despite of echo, TMT, CT, everything being fine, I still experience pain in the chest. What is your advice?
That could be muscular pain or bone pain. Many times, if a person is too anxious and stressed, those people tend to get more of muscular pain. It can be either ignored. You need to learn to ignore small aches and pains coming here and there. If you are an anxious person, take care of the anxiety. There are mild, analgesics and local application of gels which are available to take care of the pain. So that I think the doctor will suggest.
Okay, so next question is from Nikita Shinde. Is it true that hereditary high cholesterol from birth does not get deposited? My father in law is 65 and never had any problems of blockage, even if he does not take cholesterol medicine.
Yeah. There are different kinds of familial hypercholesterolemia. There are people with very high cholesterol without any coronary deposits or in the brain blood vessel deposits. They will have deposits in the skin, etc. But there are people with, but the same thing, if the children of that person can have deposits within the blood vessels of the heart and brain. So just because father did not have the all those, if the father has familial hypercholesterolemia, all the children should undergo periodic cholesterol checkup, and it has to be treated.
Right, ma'am. So a lot of people are worried about gastritis kind of issues, and warning signals of heart disease. Many questions that I am seeing. Would you kindly address these concerns, ma'am?
Yeah. See, many a time gastritis and the heart pain are mistaken. The gastritis pain comes as a burning pain, which comes in the epigastric area. It is usually related to food. It is gastritis pain comes when a person is hungry or immediately after eating, but many time even heart pain can come like this. So that's why my advice to you all is, any discomfort, any burning sensation in the chest, just go to a doctor nearby and take an ECG. If this gastritis, ECG is going to be normal, go back home. But even now we are seeing people thinking the gastritis pain as heart pain, heart burning as gastritis, and not coming to the hospital, then collapsing at home and or after coming to the hospital. So in short, I would say that every pain, every burning sensation coming in the chest, whether it's related or not related to the food, go to your doctor and just consult, and then decide.
Right, ma'am. To a lot of questions, but due to lack of time, I will just conclude it with one last question. Iqbal Baloch ji पूछते हैं, I am recovered. If I have recovered from COVID, but due to anxiety or post-COVID effects, my heart rate is 105 per beats per minute. I'm in home quarantine. How do I deal with it?
Yeah. Post COVID, the high heart rate is very common. Everyone will have high heart rate for a period of 1 to 2 months, something like 100, 120. And many are anxious. So that also pushes up the heart rate. So you may need a small dose of medicine, but which has to be prescribed by your doctor for a period of few months or weeks only, because high heart rate above 100 persistently for few weeks or months is not good for the heart. So talk to your doctor and get a small dose of heart rate lowering medicine. That should help you.
So, as we are going through the times of pandemic and COVID has become like almost present in every family, does one need to take care of heart after COVID, ma'am?
Yes, heart disease is very common. Many people are coming with heart attack following pandemic, this COVID infection, because it is a systemic inflammatory process. It increases the blood clotting within the blood vessels. That's why the blood clot within the lungs, blood clot within the heart is happens, and people come with pulmonary embolism and heart attack. So usually all people are given a blood thinner medicine for, if they have COVID. But any symptom of breathing difficulty or chest pain, discomfort, just get back to the doctor immediately.
Thank you so much, ma'am. It was a great session with you today. Very, very informative and very patiently answered all these questions, ma'am. Thank you. But before we take leave from you, I want you to give us some top tips to understand our heart health and keep our heart healthy.
Okay. So I would like to tell you all that invest in health, because health is wealth. And you all know that prevention is better than cure. So take care of your health, eat healthy diet, get exercise at least 30 to 40 minutes every day. If you are a diabetic or hypertensive, check your sugar and BP regularly at home. If it is high, control it well by going back to your doctor. If you have a heart problem already, get periodic checkup done. Do not stop your medications, and say big no to smoking, alcohol always in moderation, and take care of your stress can be taken care in different ways and means are there. If you are not able to, because stress is a major risk factor for heart problem. If you are not if you are not able to take care of your stress, get a help through the psychologist. And I will request all of you to invest in a good health insurance plan for yourself and your family, so secure your health and help us to beat heart disease.
Wonderful, ma'am. Thank you so much. Thank you for this time on a Sunday morning. We appreciate this effort of yours of coming live and addressing these questions, ma'am. Thank you once again.
Thank you. Thank you, Jansi. Thank you.
Great. So that is Dr. Rajeshwari Nayak answering all your questions and queries on heart disease. We couldn't answer a lot of questions due to lack of time, but we shall bring Doctor back and we shall try and answer most of the queries. But Doctor will be available for an online consultation on Apollo 247. Please go ahead and book your consultation. Well, now it's your turn to answer 3 questions of mine. I'm going to ask you 3 questions in health quiz, and you can win prizes from Apollo 247. You have to type your answers in the chat box, and if you're declared as a winner, we shall you have to write your details back to us at marketing@apollo247.com. Here's the question number 1 on the screen. How much blood is pumped daily by your heart? Question number 1. How much blood is pumped daily by your heart? Question number 2. What is the average weight of a human heart? What is the average weight of a human heart? Question number 3 is, which premium membership plan of Apollo 247 enables you to get discount up to 60% on diagnostic services along with home sample collection? Question number 3, which premium membership plan of Apollo 247 enables you to get discount up to 60% on diagnostic services along with home sample collection? So these are the 3 questions for this week. Go ahead, type your answers. Apollo 247 team is going to select the winners, and I'm going to get the winners' names shortly. If you are declared as the winners, do write back to us. I'm going to share the details in a while soon. All right. So now, before we find who the winners are, let me talk about the February deals on Apollo 247. Here's a Feb offer, flat 25% off on first 3 online medicine orders. The code that you have to use on Apollo 247 app is FIRST3, FIRST3, and if you're going to pay via Amazon Pay, you can earn up to ₹500 off. So you can use this Feb offer to get flat 25% off. And that's it. Not just that, let me also remind you that in case you need a general physician's consultation, in just 15 minutes, just one tap, Apollo 247 gives you an opportunity of consulting a general physician online in 15 minutes at just ₹249. You can book it now on Apollo 247 app, and you can get a benefit because it's very, very simple. Once you get the hang of using the app, it's quite easy and it takes you right there. So this is today's session. I thank Dr. Rajeshwari Nayak for being so patient. And we also have, while I'm waiting for the winners, we also have some gift coupons to be given away. All the people on the show, you can use these coupons on Apollo 247. Use code HH247 to get ₹199 off on online consultations with Apollo doctors, and also 20% off on medicine orders. You can use these on Apollo 247. And the winners for today's session are Miss Umme Salma, Vinay Gupta, and Ujjwal Sen. Congratulations. Please write back to us to claim your gifts. Also, the details to claim your gifts will be shared in the YouTube chat as well. Congratulations, all of you, and do write back to us. Thank you so much. It was a great session, and next week we are going to talk about kidney problems, causes and cure with an expert from Apollo Hospitals. If you do not want to miss this session or any future sessions every week that we do on a Sunday morning 11 o'clock, there's a bell icon. Please go ahead, subscribe, and you will not miss a single session. This is next Sunday, that is 20th of February, 11 a.m. Get ready to ask all your questions about kidney problems. I thank Dr. Rajeshwari Nayak for this wonderful and very informative session on heart diseases, risk factors, and prevention. Thank you one and all for asking your questions. We shall see you next week. Namaste.